What's up, guys? I'm going to look this way first, and then I'm going to have to turn because I got to navigate through the PowerPoints. It was a mess. I tried to get this PowerPoint up yesterday, not the PowerPoint, but my lecture up yesterday, and it was a fail. So as I'm looking at you guys, there are a few things that I need for you guys to do before midday tomorrow. Make sure that you have submitted your first and second article. Make sure you've done quiz number 3, and make sure you've done your syllabus quiz. All of those items do count as a grade. Test 1, test 2, quiz 1, and quiz 2. If you haven't taking those things, unfortunately, those are zeros unless it is a documented event or reason why that you missed those tests. A few things about test 2. Someone achieved a perfect score on test 2. So there was no curve on test 2. But test 1, there was a curve. It was a nice curve. You should see 10 points have been added to your final grade. But as I said, test 2, someone achieved a perfect score, so there was no curve. Test 3 is coming up. I'm going to give everybody some time to play a little catch up here. What I'm going to do today, I'm going to lecture chapters 30 and 31, which is basically conditions and illnesses and communicable diseases. One thing that I forgot for you guys, and I did you guys a disservice, I forgot chapter 12, which is the abdomen. You need to know about the reproductive and the gastrointestinal organs. Might need to know that. So I will provide a separate lecture for that, but it is also in the folder. But just because I forgot it doesn't mean that I won't include it in the test, because it will be on your third test. Okay. So make sure that you're reading your notes. Make sure, one thing that I noticed is that make sure you are watching all of your videos. Okay. Same thing. I know you guys put in a lot of work to get a lot of things done, and I do take my time to make sure that I review all of your work. Same courtesy should be extended for me. Make sure you watch all these videos, not just turn it on and walk away, but turn on and be engaged in it. So same expectation that I would have in the classroom, that you are engaged in the classroom. Same thing. But I say all that to say that I know sometimes the online world can be boring, because I know you'll start getting sidetracked and drifted. So I'm going to combine this 2-chapter lecture into one, and it be 20 minutes. Okay. So I'm going to set it up. If the alarm goes off, I'll wrap it up as quick as possible. And then I'm going to encourage you guys to review your notes. Also, if you haven't already done so, there are Remind app activities. The reason why I have you do these Remind app activities, because these Remind app activities are not only on quiz 4, but they are on test 3. So make sure you are doing these Remind app activities. They're not just useless activities. They're very important for the test and quiz. A few things about the test as we kind of move forward closer, as we're on our way to the end of the semester. I want you to go back, review all your notes about anatomic positioning in different various parts of the body. Review chapter 27, 28, and I believe 16. As far as environmental conditions are concerned, what I'm going to do for the next 2 test is that I'm going to provide a study guide. Okay. I am not going to answer any question on that study guide. Okay. Now, if you need to have a question for clarity, I'm here for it. Okay. But a lot of the content will be in your notes, because chapters test 3 and test 4, which test 4 is your final exam. Your test 4 will be very comprehensive, and it'll be very cumulative. Okay. So it's everything we went over in the chapter. Your final exam is 150 questions. So brace yourself. Okay. Make sure that you are reviewing your notes, making sure you're looking at the PowerPoint, making sure you're looking at all the videos, because there's going to be a piece of a little bit of everything from everything we've done this semester. So make sure that you are going over your content, looking over your videos. Without further ado, I'm going to go over chapter 30 and 31. As you can see here, I already have the PowerPoint up, and as you can see, I'm kind of looking now because, like I said, technology won't let me be great. So I have to look the other direction. And I have my notes in front of me just so I won't ramble, because those who may have had me before, you know I will ramble. So here we go with conditions and illnesses, something to consider as a future athletic trainer or future coach or future PE teacher, and even future physical therapist, massage therapists, personal trainers. You you do have to consider the condition of the individual. Now, in a previous chapter, we talked about a pre-participation examination. This is a time where you'll discover those conditions and illnesses. You'll discover it during the examination. If you're going into fitness, or if you're going to work as a personal trainer, group exercise not so much, but if you're going into gym membership, gym ownership, fitness professional, strength and conditioning professional, oftentimes, strength and conditioning on a collegiate or a scholarly level or school level, you do have to do a pre-participation examination. But sometimes strength and conditioning coaches can work as fitness professionals or personal trainers in a gym. And oftentimes you'll find out the information through you'll have a medical questionnaire, but the medical questionnaire follows the PARQ, the Physical Activity Readiness Questionnaire, PARQ. Okay, so that's where you'll find out different illnesses and conditions, such as asthma. Now, asthma, let's put my phone on mute. You may have heard of individuals with exercise-induced asthma, and that is a thing, as we talked about kind of our, in the previous chapter where we talked about our chest and thorax. Compare asthma for an athlete as trying to catch your breath through a straw while you're doing a high level performance activity, and so you'll be able to determine these things through a physical or PARQ or medical assessment. Oftentimes, if there is asthma present, your athlete or your client will have an inhaler. They have to have an inhaler on them, especially if they indicated or given any indicators of previous asthma. Sometimes those who might be recovering from bronchitis, they might have an inhaler. So either way, maybe they recover from bronchitis, or maybe they are a current asthma patient, or maybe they have exercise-induced asthma. Make sure that they have their inhaler on them. Can be genetic. Okay. You can't really determine that, especially, if you are maybe like an MD or things of that nature, you might go a little deeper, but it can be genetic. One way you can see if your athlete is having making sure my timer is on. Any issues with asthma, you can hear wheezing, you'll hear coughing. And one thing to be mindful of is that, and I know a lot of us might be encountering this, I have a few family members that are going through this, asthma can be triggered through allergies, especially this time of year as we're kind of transitioning what they call the swing season, where it's in between hot and cold for a couple of days, and that can trigger asthma. And also it is stress induced. And like we talked about, it is exercise induced. If you come across an athlete who is having or getting ready to have an asthma attack, ideally you want to keep them calm. The first thing you should do definitely, though, is call 911 just to get medical attention, because essentially it's like catching your breath through a straw. If they have their inhaler, still call 911 because there might be some damage there, but grab their inhaler if they got it. Have them sit, don't have them lay down, making sure that they breathe through their nose and out through their mouth. And most importantly, try not to panic. Keep them calm too. Okay. National Athletic Trainer Association has a statement on asthma, making sure you look at this because this is for your test. Okay. This is good for your test. So making sure you review those statements. If you have your book with you, it is page 372. Remember, you can get your book through Brightwave Tools, then Brightwave, to be able to see NATA statement about asthma. All right. So you got vascular conditions such as hypertension. We've all heard of that, where your blood pressure is 140 over 90. That's generally high. The ideal is the 120 over 60s, and it could damage your vessels, your blood vessels. Ultimately, it does damage your heart. And you may have heard individuals have maybe aneurysms or strokes, or the different medical conditions are related to vascular damage with untreated hypertension. The notes say may be preventable. I think it is preventable with proper exercise, stress management, and proper diet. You can avoid hypertension. Little small story. I can brag on my mama because I love my mama. My mom is 57 years old, and she is the only one in our family who is hypertension free. Okay. It is a blessing because most African Americans are faced with that potential, especially around my age. And I'm thankful too, because I'm not on blood pressure medication either. A lot of members of my family tend to be on blood pressure medication as early as 32. And here I am, 36, no hypertension medication. That's because I don't stress. So, and neither should you. So, give you that. Also, there's hypotension, which is low blood pressure. This is important. Okay. If you are going into maybe fitness or maybe you're going into physical therapy, that's the reason why you need to do the assessment first to get an idea of the medications that they are on, because some medications, for example, beta blockers or hypertension medication, is actually lowering their blood pressure. So you just want to be mindful of that as to why their blood pressure might be reading low, or ask if they're on medications, ask maybe they might be sick, or if they're, so maybe they've gone through shock. Generally, you shouldn't be doing any physical activity if you're undergoing shock or in shock. So those are just the two forms of vascular conditions you should be very mindful of. Another one, and it is very common. Sometimes it's more common in African Americans, but it is common as far as an athlete overall, is anemia. Okay. Anemia is a low count of iron in the blood. Okay. Iron is necessary in terms of, without going into deep detail, it's essential to the cellular process of your blood, being able to provide oxygenated blood during a workout or during movement or that type of thing. So having iron in the blood is so critical. Now, as someone who's been anemic all of my life, and some of you guys might relate, I've had symptoms of fatigue, been tired, losing hair, chewing ice like it's pizza. Those are kind of the symptoms and signs of being anemic. So some of you guys may have experienced that. Anemia is, and diet can do it because you're not getting in those leafy green vegetables that our moms and our dads tell us to eat. Make sure you eat your vegetables. Sometimes you might go to the doctor for further examination to examine anemia. You might be just malabsorption, and that's my case, just malabsorption. And so I'm very mindful to have a good diet to make sure you're not going through malabsorption. And as I said, it's just tiredness, fatigue, skin color, a little bit of everything. You can kind of tell when something's not right. So the other one is sickle cell, which is common in African Americans exclusively. And of course, that is just a blood cell shape. Basically that's what sickle cell is. Now just imagine as someone who is anemic, where they're experiencing fatigue during periods of low iron. In this case, it's almost a constant fatigue, and left untreated can be fatal. Of course, I believe the life expectancy that they're having for sickle cell anemia is, I believe, 40 or 45. But as most can see, that there's a lot of people that are living longer as a result of changed diets, changed approaches to sickle cell. I actually had a friend who passed away from a stroke from having anemia, and they were only 35. So these things you'll find in athletes. And a sickle cell test is required now for any student that is African American to participate in any sport. It's required. So, maybe you're working with an African American athlete and, they haven't gotten tested. Make sure you send them to get tested, because this is extremely important. Okay, hemophilia is just basically a condition that doesn't allow the blood to clot properly in case of injury. So basically bleeding out. Okay. Females can carry it, but it occurs only in males. Ain't that interesting? So there's different types of activities you might have to restrict in dealing with the hemophiliac. So concussion sports. Why? Because a person can bleed in the brain and it will not stop, and that can be fatal. So those are things that you find out in an examination. Okay. We've heard of food poisoning, right? Oh, how many of us have food poisoning? Oh man, I've had food poisoning plenty of times. That's why I don't eat lobster. Okay. But food poisoning, as it says here in this PowerPoint, it's explosive. Literally, it really is. And as I tell anybody, make sure that you are properly cooking your food, making sure that you're monitoring the expiration dates. Me personally, because I'm a cook, I like to look at my food to see if it's still pink, or maybe you're one that doesn't get steak often. If you're not a steak eater or a red meat eater, despite what people might tell you, make sure you get your meat well done. Not everybody can tolerate well done or anything less than well done meat. It's things of that nature you just need to be mindful of, because eating raw meat is dangerous. So, and you want to encourage your athletes that too. Again, my brother is an athlete, but he actually eats rare steak or medium rare, which is gross, but his stomach can tolerate it. And so you don't want to introduce any food to an athlete that might be new, might be foreign. You want to be careful of passing down food or anything of that nature that may have been sitting in a refrigerator sometimes. So those are just things to be mindful of in terms of good old-fashioned food poisoning. And appendicitis. Okay, appendicitis is there's vomiting involved, there's a fever involved. In chapter 12 we'll go over the quadrants, but you're going to be pain in the appendix area as far as appendicitis is concerned. Generally, your athlete might be clutching their stomach or their area right in their belly button, and they might point to the right side. So if that's the case, especially if they're talking about a fever and they're vomiting and they're in pain, 911 needs to be contacted because there's a possibility for appendicitis. Now, you don't want to assume. You want to just go ahead and call 911 and have them examined by a physician, because especially if there's vomiting involved and there's a fever, that athlete is losing fluid. So you need to get medical attention to them as soon as possible. Now we want to talk about diabetes, as I'm checking my notes, making sure I'm on task, and I am. So with diabetes, it's just basically your pancreas does not produce enough insulin, or your body will become resistant to insulin. We all know that there are two types. Okay, that there are, that you do have the juvenile version of diabetes and you do have the adult version of diabetes. One thing I'll tell any student, any individual, as far as one who drinks sports drinks, I'm not a big fan of sports drinks. This is just my statement, not Kentucky State statement. But I do not promote any sports drink, especially if you're not doing any activity longer than 60 minutes. If you're doing an activity longer than 60 minutes, then I'm okay with a sports drink. But you should not be drinking a sports drink if you were doing any activity less than 60 minutes, or if you just going to McDonald's and getting a Powerade. Do not do that, okay? Because sports drinks are loaded, not only with salt, but they're loaded with sugar, which on a chemical level, you lose in workouts that are done over an extended period of time in that moment, okay? But again, I'm gonna get off my soapbox because, but that, again, I don't really recommend any type of sports drink whatsoever, because it's just, to me, it screams diabetes. But you have different types of diabetes. I talked about type 1 and type 2. You have gestational diabetes, which occurs for women who are pregnant, and then you can be pre-diabetic. DOPE has done a diabetes testing, and we're actually looking to do the same thing next year as we eventually come back on campus, testing for pre-diabetes. I tell any client, if you really want to ward off the diabetes, you want to monitor your sugar intake. You do want to monitor your stress level, because like I said, on a cellular scientific level, stress can kind of compound into something greater. And also, if you're not already involved in a strength training program, I highly recommend you do so. So, and this is critical for your athlete as well. Okay. You want to encourage them to maintain a good diet, maintain lowered stress levels, and be mindful of the things that they drink. Okay. I'm gonna move a little bit fast, because this chart, critical part on your test, it compares the difference between a diabetic coma and an insulin shock Very different. Okay. You'll get a diabetes care plan based off of the results of the pre-participation examination, or maybe from a physician that may have gotten a medical clearance from before you do physical activity with somebody. I got 7 minutes, so we're going to move fast. Okay. Epilepsy, I might have to make this too. I tried. Epilepsy, we do know that is a chronic condition that does entail seizures that can happen at any point, any given time. And so these examinations are important to determine if your athlete is epileptic. Whew, that's such a mouthful. Okay, arthritis. You might hear about, oh yeah, the old folks got arthritis in their shoulder and their hands and their back. Guess what? Arthritis can happen to you too through overuse. So, we've heard of gout. I've heard of gout. We used to call it the rich man's disease because it's basically just uric acid just building up, which you can find in different foods. So, and then there's rheumatoid, which is a little bit more tied to your immune system, and it can be very debilitating. All right, so you got the female triad, all right? So when you're talking to your female athlete, you want to be very mindful of eating patterns, okay? You don't want to ask a female athlete, are they okay? Why aren't you eating this? Why aren't you eating that? Because there may be some disordered eating going on, okay? You have anorexia and bulimia. Anorexia is the reduction or the stop of eating, basically just not taking in any calories, but there might be an obsessive behavior such as exercise. And bulimia is the excessive intake of calories, but yet pushing those calories out or purging the food that you just ate through forced vomiting. So those are really the differences between the two. One is you're not eating, and the other is you're gorging, and then to turn around later on and forcing yourself to push that food out, primarily through vomiting. So you want to talk to your female athlete. There may be, as a result of such changes with the body, there's a few things with bulimia that not only you think, oh, well, they're eating something. Yes, they are eating something, but the stomach acid from the excessive vomiting can damage the esophagus. So you want to be mindful of that. Also, one thing to be very mindful of, sorry, my phone is blowing up. One thing that you want to be mindful of is if your female athlete, if their cycle has stopped, okay? Amenorrhea, I can never say that. But we're just going to go on. We just got mistakes on here left and right, whatever, because my phone's been ringing all day. But basically, it was when the cycle stops, okay? And the reason for it being, just loss of body fat. Ladies, I can tell you, I can attest to that, at one point, I ain't want no fat on me. I was like, just get rid of it all. But we do have a reason to have fat on our bodies. Why? We bear children. So that's the main reason why we do need certain fat levels on our body. And if our body fat levels drop to a dangerous rate, that's when our cycle can stop. And as much as that might sound nice for your cycle to stop, you don't want it to stop because you've reduced your body fat. So, because then what happens is that your body will face osteoporosis early. That's the reason why you may have hear about women who are going through menopause also go through osteoporosis. All right. So you don't want osteoporosis in your female athlete who might be 16, 17, 18. Bones are still growing. The body is still shifting. So osteoporosis is a downward spiral as far as the female triad is concerned. So you want to always cross-examine your female athlete and see what's going on with them, especially when you kind of notice some disordered eating or obsessive behaviors. Now, what I like to call rhabdo. All right. So there have been studies that have been done. How many of us have done CrossFit? I've done it twice. And the first time I vomited. So second time I went back for more and I was sore from head to toe. It was worse. So I haven't done CrossFit since. So, but CrossFit is a good workout. But an article came out shortly, well, not shortly, I would say maybe about 3 years after CrossFit exploded. That there are athletes that are coming in there saying that they're doing CrossFit and basically having basically urinating blood, or basically reporting that they are so sore, and basically facing kidney failure, that type of ordeal. That's a condition called rhabdo. It's basically just a breakdown of your muscles, okay? And with the breakdown of your muscles, goes into the bloodstream, and it's fatal. Point blank, period. So my previous institution with gentlemen who wanted to come in and they wanted to really get a good pump, or a really good strength training workout. Two of them went to UK hospital because of rhabdo, and one of them almost died. So be mindful of the intensity levels that you are working out with, because you don't want rhabdo. All right. So I am going to have to do 2 videos. Sorry, I tried. So just make sure you're going over, review the notes, and I will see you in a bit. Peace.